What is the definition of multiple exceptionalities? Well, it is the combination of learning or other disorders, impairments, or physical disabilities that is of such a nature as to require, for educational achievement, the services of one or more teachers holding qualifications in special education and the provision of support services appropriate for each disorders, impairments, or disabilities. Students with multiple exceptionalities tend to have specific characteristics related to their learning, which are intellectual functioning, adaptive skills like conceptual, social, and practical competency, motor development. They produce abnormal muscle tone and have difficulty sitting and moving, sensory functions, communication skills. Most students with multiple exceptionalities have many impairments in intellectual functioning, also have communication impairments, and limited or no speech. Here are some signs and symptoms to look for in individuals with multiple exceptionalities, and certain aspects are looked upon further for diagnosis. They include movement and limitations, muscle tone and flexibility, seizure activity, breathing control, sucking and swallowing, vision and hearing, and genetic makeup if it comes to it. They also look for behavioral skills as well when they are looking for signs and symptoms like communication, self-care, social skills, self-direction, and academics. Students with multiple exceptionalities has increased in both elementary and secondary. In elementary, it went from 5,150 students to about 6,000 students, which was a 20% increase from 2009-10 to 2018, while for secondary, it moved 10% from 5,280 all the way up to 5,881. School boards do a lot to identify students with multiple exceptionalities. Specifically, the Hamilton Whitehouse Catholic District School Board has written reports from a member from the College of Audiologists and Speech-Language Pathologists, the College of Physicians and Surgeons, the College of Psychologists, and then an individual directly supervised by a member, or the College of Social Workers, and each clearly delineates the nature and severity of the problems which the student is experiencing and provides a diagnosis of the problem.
Now I'm going to be talking about myths. The first one is that all students with multiple disabilities are severely intellectually delayed. The second myth is all students with multiple disabilities have no oral language. The third myth is people with disabilities are more comfortable with their own kind, and the fourth myth is that people with multiple disabilities cannot lead a full and productive life. Children with multiple disabilities face many challenges, including the physical infrastructure of the school, inability of staff to directly respond to the children's needs, a lack of differentiated teaching and learning resources, poorly structured curriculum approaches, children struggling to communicate their wants and needs, as well as children struggling to move their body freely and access and engage with the world. So I'm going to talk about the common educational challenges associated with learners with multiple disabilities that revolve around these issues. The child's ability to effectively communicate with others, making a safe and inclusive space that suits the child's level of development, assessing the learner for different challenges, and finally, the student's ability to function in a classroom setting. Some examples of multiple exceptionalities. A child could have an intellectual disability and deafness, another child could have cerebral palsy and autism, and another one could have cognitive challenges and a sensory impairment. All impairments may occur in cognition, motor, and sensory functions, and there are many possible combinations. Next, I would like to look at another example of multiple exceptionalities. In this case, we're talking about twice exceptional learners who are students who are both gifted and disabled. These students are at risk of misidentification and underachievement in school. Students who are twice exceptional can be inquisitive and impulsive, and they need programs that focus on their areas of talent.
Students with multiple exceptionalities often require a significant amount of administrative care, and because this category includes a diverse range of students, it can be difficult to establish an appropriate placement for each student. The placement options for students with multiple exceptionalities vary between school boards. Some boards avoid placing students in this category altogether. For example, the HDSB and the SCDSB generally do not make use of the multiple exceptionality category. These school boards prefer to identify students according to their dominant exceptionality or area of need that affects their learning the most, while allowing the IPRC to also list other contributing exceptionalities on the Statement of Decision and corresponding IEPs. Students with multiple exceptionalities are offered a wide range of placements depending on their strengths and needs. Placements can range from a regular class with varying levels of support to a special education class with varying levels of integration. Due to the increased awareness of differentiated instruction and universal design for learning, practices that isolate students into specialized settings are decreasing. Self-contained classrooms should be used with the intention of reintegrating students into the regular class, and they should not be used as an indefinite placement. Because students with multiple exceptionalities are extremely diverse, it's hard to pinpoint specific strategies for this group as a whole. However, programming for students with multiple special needs will usually be highly individualized, have a significant amount of specialized support, and include frequent communication and cooperation with the student's home so that their education and habilitation can be coordinated outside of school as well. In some cases, a multidisciplinary team of professionals with specialized expertise can be established. For example, a student with multiple needs, such as a severe physical disability along with behavioral and developmental problems, may require the services of a variety of personnel. For this type of student, a multidisciplinary team may come together, typically at the beginning of the placement process, in order to identify and appropriately respond to the student's needs.
Students with multiple exceptionalities require a special education program and services to fully benefit from their educational experience. They will be referred to an IPRC set up by the school board and will be provided with appropriate special education programs and services to build on their strengths and meet their needs. An IEP must also be prepared and maintained for students with multiple exceptionalities. The OME's special needs strategy seeks to assist children with multiple exceptionalities and their families access services through coordinated service planning, which provides them with a service planning coordinator who helps to connect children with multiple exceptionalities with services and supports, as well as monitors their coordinated service plan, which is responsive to the child's individual goals, needs, and strengths. Multiple exceptionalities are not all the same, and many combinations of disabilities are possible. So when discussing how to overcome educational challenges, it is important to note that this will look different for every student. To overcome educational challenges, it is important that teachers know the needs of their students and play to their strengths. Learning about a student with multiple exceptionalities, interests, and preferences can help them become more engaged and improve their educational experiences. To improve educational experiences for students with multiple exceptionalities, teachers can implement assistive technology and alternate communication methods, such as text-to-speech technologies, educational apps, hearing aids, braille, and/or sign language. This can help students with multiple exceptionalities that have communication challenges or visual and/or hearing impairments. Teachers can also help to improve the educational experiences of students with multiple exceptionalities by understanding the areas of support they need. Some areas of supports may include performing manual tasks, seeing, hearing, walking, standing, lifting, bending, communicating, learning, reading, and concentrating. However, all students differ, so it is important for teachers to refer to the IEP to see which specific areas of support are needed.